One of Maine's largest healthcare providers announced it will let workers go to avoid another fiscal year in the red. Northern Light Health lost more than $156 million last year, adding to the $600 million they already had in debt. News Center Maine's Christian Harsas today spoke with leaders at Northern Light about what that decision now means for employees and patients. He's joining us live tonight from Eastern Maine Medical Center in Bangor. Hi, Christian.
Hi, Brian. Northern Light will be cutting back its workforce and rearranging its care services over the next couple months in an attempt to balance its finances after years of incurring debt.
And as this plan evolves over the course of the summer, we'll be sharing more information. But for right now, our focus is to let people know that we don't have a sustainable business model.
Northern Light Executive Vice President Paul Boland says over the next couple months, the healthcare system will be assessing where staff cuts can be made.
And now is the time when we need to pull in our staff, our physicians, our nurses, and others to make sure that we get the feedback and have that input.
Boland says Northern Light is not trying to lay off a large number of people all at once. The system already cut 90 positions last quarter as employees retired or left Northern Light.
Each one of those is an opportunity to determine, can the work be done differently? Do we have to continue to do the work? Can someone else do the work or parts of it?
Right now, Northern Light isn't saying how many jobs need to be eliminated, where those cuts will be, or when. Potential changes to Medicare and Medicaid at the federal level are making revenue estimates difficult. But the system has set the start to its 2026 fiscal year, October 1st of 2025, as the deadline for financial stability.
This is the future we are facing.
President of the Maine Hospital Association, Stephen Michaud, says finances are on the minds of many healthcare leaders in Maine.
How much staff can we afford to have? How many services? What does that look like? Pretty much everybody is going to be going through something similar to one degree or another.
Despite the challenges, Michaud expects Northern Light to remain a pillar of healthcare for patients.
We've got a future of restrained resources, meaning money.
Maine State Nurses Association President Cookie Giles hopes patient safety remains a priority, writing in a statement, "We caution Northern Light to not balance its books on the backs of its patients or staff." But Michaud says longer drives and waits for care are likely.
But I do think that they need to understand we're all in for some changes that we're not going to like.
Northern Light officials say that they also plan to centralize care and run more telehealth operations out of Eastern Maine Medical Center in an attempt to reduce costs. Hospital executives say that those changes and staff cuts are expected to begin in the next 2 to 3 weeks as that self-imposed October 1st deadline draws nearer. Brian?
Christian Harsas with those developments live in Bangor tonight. Christian, thank you.